I ask for approval of the previous month's meeting minutes. Supervisor Montesi, and second by Supervisor Simpson. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? That carries. We'll start today with the Public Defender. Sterling, like to...
You have to talk as fast as Marcy.
I don't talk as fast as Marcy, that's not possible.
No one can talk.
I know, that's what she does.
Okay. Yeah.
Thank you.
Thank you.
You got a short?
Can I pass it over?
Huh? May I have some, Sterling?
You can be.
I'm good, how are you?
Good, everybody have one?
Thank
Hmm?
Very simple, only one item, requesting permission to attend, two seminars, one for the First Assistant Public Defender and another one which is more of a statewide, Public Defender CLE, at no cost to the county, would be fully funded by the Office of Indigent Legal Services, but it does require your approval.
Okay, motion by Supervisor Gerard. Do we have a second? Supervisor Dickinson, any discussion? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Thank you,
Anything
and that
else?
is all.
Thank you so much.
Take care.
Move on to the Sheriff's agenda.
This works. A lot of paper.
I know, I was wondering.
This is the same as with the ladies, the Board of Election
they all
ladies.
go on one
So many
thing.
pages.
Go ahead, Sean, whenever you're ready.
All right, good afternoon. About half a dozen items on our agenda. Under action agenda, item A is request permission to have Captain Michael Gates, Lieutenant Albert Mayday, and Lieutenant Daniel Clifford attend the jail administrators training program, which is September 26th of this year through September 29th of this year. Total cost to attend the conference is $1,050.
A motion by Supervisor Simpson, seconded by Supervisor Frazier. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Item B is request permission to have myself attend the New York State Sheriff's Association Undersheriffs Training Conference, which is next week. Total cost for that is $300.
Okay, Supervisor Montesi and seconded by Supervisor McDonald. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Item C is notice of intent to fill a vacant position. The position is a senior account clerk. Mary Weaver, who's been with the county for around 28 years, is retiring at the end of this month, and we're seeking to replace that position.
Motion by Supervisor Gerard. Do we have a second? Supervisor McDonald. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Item D is request a resolution for a new contract with Seaward Equipment to provide preventative maintenance to the Sheriff's Office septic lift station pumps and the Muffin Monster, which are located on our property.
Okay. Do we have a motion? Supervisor Simpson, second. Supervisor Dickinson, questions? Ms. Bramer?
Thank you. Did this go out for a request of proposal?
It did not. It's a sole source. And we have a sole source letter. It should be attached to your packet.
Supervisor Brock?
What's a muffin monster?
That actually, believe it or not, is the technical name for a large grinder that grinds up the sewage and stuff that comes out of our facility. The lift stations were put in back when our facility was built. We moved in back in 2004. As of late, during the last year, we've had quite a few problems with it because preventative maintenance had been eliminated due to budget crunches of the years past, and we're trying to get back into a good schedule. Such problems that we've had where people would flush the toilets in the jail and the sewage would actually come up through the shower drains. So that's some of the problems that we've had.
Okay, any other questions? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Item E is request resolution to amend the county budget as follows. Revenues to be received from a 2016 state law enforcement terrorism prevention program grant in the amount of $20,000, which will purchase ballistic vest and portable scene lighting.
Okay, we have a motion, Supervisor Montesi, seconded by Supervisor Simpson. Any questions? Supervisor Sieber?
Is there, and I just don't see it here, and I might have completely missed it, but is there any cost to us, or it's all covered through the grant?
On the 2016 grant,
Yeah.
there's no cost to the county.
Any other questions? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
Item F, we were asked late last week by the Treasurer's Office to request a resolution to close a capital project, H317-2011, which was sheriff vehicle purchase, to return an estimated $3,374.50 that was left in the project and return it to the debt service fund.
Motion by Supervisor Gerard. Do we have a second? Supervisor Frazier?
I have a question.
We have a question from the chair.
So, how are you purchasing your cars? Not out of this account anymore?
This is apparently a capital project that was set up in
It's an old one?
2011. It was before I had anything to do with it. And these were monies that were apparently left in that capital project.
Okay. Are we sure, Frank?
I think it was prior to the reserve fund.
Oh, okay, all right.
You just
Too much to
transfer,
lose.
you transfer back to the reserve?
It was before the reserve fund was established. Previously, they were purchased through the debt service fund, as I understand. So when you close it, it goes back to the source of the original funding, which in this case would be the debt service fund. Since then, we now have the vehicle purchase fund, so it would, in future, and probably back to there. Any other questions? Hearing none, all those in favor?
Aye.
Any opposed? That carries.
I was
Topics?
advised by the clerk of the board that there was unfinished business in regards to, my understanding was Supervisor Sieber wanted to discuss the installation of a magnetometer in the municipal center.
I think that was just a pending item that's been lingering, Sean. We're waiting, actually, I think more for the court expansion, because I did speak to Supervisor Sieber about that, to find out if there's going to be a, we'll call it a spare magnetometer that perhaps we could use. So I think that that's just kind of pending right now. I don't think it's anything, unless Supervisor Sieber disagrees.
No, I agree. I think the last time we did discuss it in this committee, and that's why it's remaining on a pending item. But I think the issue became, can we get one that, you know, would be free, and would the board want it at that entrance? And I don't think we're in a position to make any of those decisions till we know if we actually have the
We actually get
equipment,
one, I think.
So I
Yeah.
think it just stays on there, you were telling me, right, until...
Yeah, I think it's just floating around as a pending item, so I don't think it's anything that we felt compelled to address today.
Okay.
Thank you, though,
Uh,
Sean, for bringing it up.
The last thing we had on there is under topics for discussion. Grayscape has requested the sheriff's office to provide uniformed officers to park during business hours. Grayscape has agreed to reimburse the sheriff's office for whatever the cost of the coverage is. We've calculated the estimated cost for the county would be approximately $55,000.
Okay. Motion by Supervisor Gerard, seconded by Supervisor Bramer, and then do you have a question as well?
I do, yes. How typical is this kind of thing? Is this,
Well, with Great Escape, Buddy, it's, I think it was in Agawam, Mass, they have police officers that they pay, that actually have a station right on there. So, it's something we did in the past year, back in the early 2000s, we haven't done it since, because we didn't have the manpower. We really don't have the manpower now. When they called me, I told them we could do it, we'd be more than happy to provide the service, but it'd have to be all on overtime. And, so they budgeted I think $55,000 or $57,000, I talked to the park manager 2 weeks ago, to cover that. And I also told them that we're not gonna be able to fill all the shifts because of, all of our summer business, we need all hands on deck, so they understood that. So, when we can provide the overtime, we'll send an officer there, and they're happy with that. This is something that they wanna pursue in the future, so maybe during budget season we'll talk about it and see if they wanna fund it.
Sheriff, didn't we also do it part-time last year?
We did it part-time last year,
Yeah, okay. So,
do we do that for other businesses too? I mean, what?
Nobody's asked us to do it, no. Nope.
any other questions? Supervisor Thomas?
Strictly overtime. They are paying, we came up with a figure of $55 an hour just to cover the overtime, and that would cover whether we had a sergeant that was available to fill a slot or a patrol officer. And of course, the guys are eager to get the overtime, so, and, we think with what's happening in the world today in parts across the world, it's probably a good thing. If they want it, as long as we can provide it, we'll do it.
Any other questions? All right, I suppose we'll need a motion in a second. Do we? Supervisor, we already have one? Okay, I thought we did, but then I had a moment, I wasn't sure. All right, so we have a motion in a second. All those in favor?
Aye.
Any opposed? And that carries. Anything else for us today, Sean?
No, that would do it.
Sheriff, did you have anything? No. Excellent, thank you both. We'll move on to emergency services now.
For the record. They came in. I'll tell you, we gotta figure out a better way to do this.
Okay.
They probably need to keep up,
Gotta
they
run
have
down
like
those
physical,
Roberts
whatever,
things.
yeah.
More?
No, I think we're good, Brian, thank you.
Or he's off today and came in for the morning meeting. Thank you, Brian.
Thank you, sir.
I like being here. Oh, I got two.
Thank you.
I didn't realize.
Is it because you wear Miami Vice sunglasses?
Yeah. That's the only. Remember we talked about Friday?
Where'd you get that little fun fact?
I didn't want to tell you. Yeah, boy.
From who?
Okay, Brian, anytime you're ready.
Thank you, Supervisor Wood.
The idea is.
Yeah.
Our first item is a resolution request to create a contract with a company called TSI. These are the people that certify and repair our mask confidence and our units that we use for testing the masks that the firefighters and the public health and all the others that have to have these annual certifications. The units do need to be sent out regularly, and the units we have plus the units that are part of our consortium, so the consortium actually will be picking up the cost for this.
Okay, do we have a motion? Supervisor Simpson, seconded by Supervisor Gerard. Any questions? Supervisor Sieber?
Just briefly, so when you say you're going, through this entity, it's shared counties that all benefit from this grant? Like they all share?
It's a 7-county system, the 7-county consortium. One county has to be the fiduciary agent, and that person is the one that sets up the contracts and does all the purchasing on behalf of the 7 counties. So the grant is awarded to Warren County as the fiduciary, and we're responsible for all that purchasing.
I think that's such a great model of sharing with all the other counties, in terms of shared services.
They took, across the state, they went from 107 hazmat teams down to 32. And by doing this consolidation and all that type of work, the state actually has saved quite a bit of money doing that. Plus, it's a better system. Not everybody needs to buy a $100,000 piece of equipment if the guy next door already has one. So, yes, it's a good plan.
Any other questions? Hearing none, all those in favor? Aye. Any opposed? That carries.
Next item is a resolution request to raise both sides of our budget for the $60,000 that we received in the Homeland Security FY16 grant. This is the other side of the one Sean just mentioned. There's a law enforcement side and there's a Homeland Security side. And we need to raise both sides of the budget so that we can commence those purchases. We did just receive word that we have the contract in place for that.
Okay, do we have a motion? Supervisor Frazier, do we have a second? Supervisor Montesi, any discussion? Hearing none, all those in favor? Aye. Any opposed? Okay, that carries.
All right, under items for discussion, Supervisor Wood contacted me a little while back and asked if we couldn't talk again about the EMS scenario in Warren County. And I've done some research, additional research, met with our EMS coordinators and with a number of the squad captains, and there is no question that there is still a problem with EMS in Warren County, and it's not going to get better, it's only getting worse. And even though a number of the towns are putting up quite large sums of money to their emergency squads to no longer use volunteers but mainly use paid staff, the problem we're running into is that paid staff is not available either. There physically isn't enough providers in the area to fill the positions that need to be filled. So that leads to several questions. We find that we have providers that are shopping. This squad will give them 15.25, this squad says, well, I'll give you 15.30 an hour. Next thing you know, then the squad that did have them now doesn't have enough people, but the guys that added it up and put some more in there. And we end up with this progression of raising the hourly rates, which I guess is good for them, but it doesn't solve the problem that we have that there physically isn't enough providers. Right now, we have squads that are using firefighters out of Albany, people from Essex County, and we have these people, and it's great that they're willing to come and help and get paid for it on the days they're not doing their normal job, but that doesn't help us as far as getting more providers in our area. And it also ends up with, we have people driving the ambulances right now that have no idea where they are or where they're going. And even with GPS, that isn't necessarily a great thing. So we've kind of lost some of the local capabilities of and the people running our ambulances knowing the area and knowing the people, especially the people they deal with regularly, the frequent flyers. That's an issue, that is a problem. So the question is, how do we deal with this? The most expensive piece of the EMS is the paramedic type, or the critical care technician. This is the person, the ALS tech, as it were. You can have the EMTs, but you still, if you are listed as an ALS, Advanced Life Support Squad, you're supposed to have an ALS provider on each shift. And the problem is there just isn't enough of those people in our area. So it brings us to several issues. Number one, how do we make that work? Do we go to a full-time EMS scenario? I know that there are towns and people that certainly do not have the money to do that. There are towns that are already paying a large sum of money to have that done. Unfortunately, when you do that, the squads that already are getting paid to have those people, they also are obligated to make sure that they are covering the calls in their own town. So when you have a town that says, okay, I happen to have 2 crews on today, and we can handle 2 calls, but 2 towns away they're calling for help, and the guy goes, I'm sorry, we're not going to leave our town. We're not going to leave our town unprotected, who's paying us through their taxes, to go cover a call somewhere else. So that's the problem. The other problem we have that I see is the management of this whole paid scenario is very convoluted. The squads pay usually a service, some company that handles their payroll and scheduling, like Akina, or there's a company called E5. There's a number of them out there. But they also are now going to take a 5 to 10% cut or add on to your bill for their services. And then if you're paying somebody to do your reports and do your billing for you, there's another scenario. So what we see is that we have a lot of little organizations running around, some of them spending, unfortunately, quite a bit of money, which they have to. I'm not saying that we don't have to have the paid people, we do. The volume of the calls that we're dealing with in this county right now has risen substantially. I'm not talking a little bit, I'm talking a lot. Everybody now, from what they see on TV and everything else, they don't feel good, they dial 911. The 911 operator is not a doctor. They follow the EMD, the emergency medical dispatch protocols. It says send an ambulance. Whether they have fallen down and can't get up, or whether they're having a heart problem, we're still going to send an ambulance. When we send that ambulance that has an ALS provider on it, and it's a BLS call, basic life support, the person that has fallen down and probably doesn't need to go to the hospital, yet the crew that is on that ambulance, by their rules, has to have an ALS provider in case it was an ALS call. So now we're spending money for an ALS provider to go to a call that they're not needed on. So there are a lot of things that we can do, pooling resources, sharing ALS techs between organizations. There is obviously the issue of all of the squads, fire departments are all the same. They're all very territorial. They like to have their own stuff and have their own people. The problem that we're having is those people don't exist. And if they do exist, they're not necessarily accessible. when we end up with any kind of a major incident, like the bus crash in Minerva we had recently, finding that many people, especially during the day, is very difficult. So, the question that is brought forward is, does the county need to intercede here somehow? And if so, how would that work? We've discussed this in the past. The last time this was discussed before the full board, the board was polled, those that were in the room, and every person said, well, we don't think there's a problem. So we dropped it. And now Supervisor Wood has asked me to look into it again. The problem is not going to get any better. And the problem we're also seeing is in the next 5 years, you're going to see the same situation with the fire service. Lake George just hired somebody to be their station keeper, a guy to drive the trucks during the day because everybody's working. This is going to continue on. Excuse me. You can see this in the areas that are ahead of us, whether it be the town of Colony, Albany, counties to our south especially. The Essex County has just taken their ALS coordinator and made her full-time. She actually responds with an ALS rig right out of the county building. But she may be going 70, 80 miles to get to that squad. So, the people that we deal with, our customers as it were, the constituents in our county, they expect to see somebody when they dial 911. They think somebody's going to show up, like Johnny and Roy did on the old show Emergency. And these people are going to have all the toys they need. They're going to be able to talk to the hospital, and they're going to magically cure them over the radio. And with the tourists that we have, or the people that live here seasonally, that's the type of service they may get where they live, whether in New York, New Jersey, or wherever, where there's a lot of paid services. They may be able to get that, but they're not going to get it here. Waiting 30 minutes to 45 minutes for an ambulance when your husband is having chest pains, that's an issue that we are trying to deal with. Unfortunately, the people that arrive on the scene to deal with that scenario, knowing that they're already showing up 45 minutes late, they're already, if you look at the golden hour, the time that they're supposed to have somebody to the hospital within an hour, and they don't get there till it's already 45 minutes into the call. The percentages of success change dramatically. So we get into the legal side of it. What's the litigative side of it? Can we get sued because we don't show up on time? In the old days, we used to be able to say, well, they're just volunteers. And that worked for a while. But these days, when people see an EMS tax or they see their taxes going up to pay for the squads to have these people, and they still see 45 minutes to get somebody there, and when the person gets there, they have no idea where they are or how to get back to the hospital. These are all things that are difficult, and I know I'm sounding very negative, but these are the problems that are out there. There physically isn't enough people to do the job. This is not just us. This is happening across the country. There are a number of things that have been done, things that have been put together to try to make it work. I'll give you one suggestion. Columbia County, they took all the squads and they formed a consortium. Squads are still individual organizations. They have their houses, they have their stuff, but they're in a consortium. And that consortium does the billing, the scheduling, and does all the stuff to keep them running. Every time they take a call, that particular squad takes a call, then the money that comes from the company that did the billing gives them their stipend for what they did with that call. That same consortium also provides all the ALS. They'll take a county our size and say, all right, we're going to put 3 ALS providers 24/7 in Warren County. So you only have EMTs in your squad building that you're paying for, or volunteers if you can. And if it's an ALS call, wherever the closest fly car, that's what they used to call him, the ALS provider is, he's going to that call. But the rest of the time, you don't have somebody sitting in every one of those squad rooms being paid as an ALS provider. So the consortium scenario has worked. It is not free. There still is a amount of dollars that has to be provided by the county. That's something that has to be dealt with. There's a lot of things involved in this, but we can't continue to ignore the fact that it's getting worse. We're squeaking by, and that's a bad term to use in front of the press, but the bottom line is, it's not, like I say, it's not just us, it's every county, every state in the union. There physically isn't enough people volunteering to do the job. There's a few towns that are very fortunate. They have enough people and they're doing it, and I give them a great deal of credit. They have enough people to do the job. But there's areas that just don't. Evelyn, you went through this, you know exactly what I'm talking about. So I would like, if this is the route you want me to follow would be to look into this further. But I think the first thing everybody needs to acknowledge is, number one, is there a problem? If there isn't a problem, then I'm not going to get into it. If everybody acknowledges that, hey, you know, as a small town and, you know, I'm paying taxes and I'm paying a budget towards the squad, and if my people are not getting the results that they think they should get from the squad, what are we going to do? Unfortunately, with Glens Falls being a hub hospital for all the squads that are coming from outside our county, Washington County, up in Whitehall, or Essex County, all these people, if they're coming to Glens Falls, chances are they're going to call and ask for one of our ALS techs to meet them en route if they don't have one. We're obligated to go. Our ALS tech gets in their ambulance, so now we have 2 ambulances out of service that can't respond to calls. So there is a great deal of this that needs to be dealt with. The old days of mutual aid, yeah, it was great once in a while. But if you have one squad that's going into another territory 6 times a day, which is happening, those are serious issues. If you're the supervisor or you're a constituent in that town and you see your ambulance going somewhere else all the time, burning up your fuel, and more importantly, taking the providers that are there for those constituents out of the county. So I would like to see us, you know, I'm not going to stand up here and say that there's some magic bullet, and that I can give you a number and say, you know, you put $1 million into this a year and you're all set. That doesn't exist. This is a situation where just throwing money at it isn't necessarily going to fix the problem.
Supervisor Simpson, I know you had your hand up there.
Yeah, I'm sorry I missed the first part of this. What happens to BLS? Are they, because you have BLS and ALS, are they just EMT, where we have EMTs?
That depends on what the resources are that you have. Unfortunately, your volunteer resources are an unknown. You could have, okay, I have 8 EMTs, I'm all set. They can ride with the ALS guy. Well, that's okay, unless it's a nice sunny day on a Sunday and everybody's on a picnic. You are at a point where you're going to have paid crews taking all the EMS calls.
We have a mixture of volunteers and paid. We are having difficulties in filling. We struggle all the time. Thankfully, we have the volunteers that we have.
Some of the bigger squads, I mean, you know, I'll use West Glens Falls as an example, and they work very hard, but, you know, there's times when they need 3 or 4 ambulances on the road at the same time. And the first one is paid during the day. Sometimes the second one is paid. But then you get to the third one and the fourth one. So now they take 2 out of Bay Ridge. Bay Ridge moves North Queensbury down to cover the rest of the town. So then you got 1 ambulance trying to cover the entire town of Queensbury. I mean, West Glens Falls will do 4,000 calls. These are numbers that have to be looked at. In the days when this first started, when people were getting paid, when the local municipality or whatever, or the squad, was able to bill for service. They billed your insurance company, and they were making money. This was great. This is how you end up with a squad captain in Saratoga County that's making over $100,000 a year. But we're not going there. The bottom line is, that has changed. Medicare, all these groups, they're cutting back on how much you can bill them whatever you want. You can bill them $1,200 for a ride in the ambulance, plus mileage. But if they only pay $300, and with Obamacare, nothing against Mr. Obama, but with other types of medical insurance, the pay rate is substantially different than what it was when this first started, where they said, hey, let's have paid people, because we can get reimbursed, we're gonna get reimbursed from that, we're gonna get that money. And, it's tough. So,
Supervisor,
I'm sorry, Ron?
you have another one?
I just wanted to finish up with that.
I'm sorry.
I had two questions. The second one was, Essex County. I read an article where Essex County is looking at, changing their structure, looking at, is that what they're doing, the consortium?
Yeah, I
Or
mentioned
is
that
it-
while you're out.
Oh, that's what I was
No,
saying.
not a problem.
Now,
No, they took their part-time ALS or EMS coordinator, made her full-time, and she has a fly car there where her office is. And if the other groups can't get out, then she's on the road. But again, that's one. What do you do when you have the other things, or you have a bus accident on the Northway, or you have the things that they deal with? There's no way you can ever say, okay, I'm gonna have 25 squads sitting here fully equipped all the time. You know you can't do that. But you need to be able to cover what you have to cover for your constituents. And, that's the scary part. Ron?
Brian, you said that, one of the things we were having a problem is ALS. Just let the group know, how many hours does an ALS need to qualify as an ALS?
It would be inappropriate for me to quote you that, because I don't know the exact number off the top of my head, but it's huge. It's like 500 hours.
Yeah, I mean, that was,
Yeah.
it's almost 100 hours for an EMT.
EMT's 135 now. Firefighter's 103 now.
Now, if you have a consortium, will the consortium also save money by being the purchasing agent for the group?
That's the whole thing. When I mentioned pooling resources, this is a huge thing. Pooling resources, having only one squad have an oxygen fill station instead of all of them. There's equipment out there that gets duplicated, and I do think that there are, things that could be done, instead of every squad having a spare defibrillator in case one goes down, maybe every 3 squads could have a spare defibrillator and share it. The same thing with the cost of all this equipment to maintain it, very expensive. The defibrillators, you can spend up to $60,000 for one. So these days, to put an ambulance on the road, the ambulance itself is about $160,000. And then with the equipment, you add another $80,000. So it's not like it was back in the old days when you could buy an ambulance for $40,000 and everybody thought that was a lot of money. Just to equip one and then to put all the people in it. We would like to get a paramedic program here locally at ACC. We haven't had any luck with that. The EMS program has collapsed there. So at this point in time, the Elizabethtown, the hospital in Elizabethtown in Essex, they are working to put together a paramedic program that can run out of there. In Franklin County, the ALS is provided by the hospital. The county provides the fly car, the equipment, and staff from the hospital are required to operate it.
I think Supervisor McDonald is next, and then Supervisor Brock.
A couple things really. We have a shared service meeting on Friday. I think that would be a great place to discuss something like this. But to move forward with it, I would imagine we need a lot of data from the individual towns in terms of what their costs are, what the bodies, how many bodies they have, and bring all that information to the table and see where some synergies might lie, and turn this hypothetical conversation into some sort of action.
I don't disagree with it at all, Matt. The problem we run into is getting that information. Some people are not willing to release that information or to know what they're really doing, what they're paying for, what they're not paying for. We can get the actual runs. I mean, from the radio room, I can tell you exactly how many calls each squad went to, how many that they got dispatched to but couldn't go to because they didn't have anybody available. We have times now where there are squads that the first squad doesn't get out. After 7 or 8 minutes, the dispatcher automatically goes to the next squad. They don't get out. They go to the next squad. They don't get out. So each time you add another 7 or 8 minutes onto that call,
I'd also add, I don't think necessarily that the towns themselves would have a lot of that data. That's gonna have to come directly from the squads. While most of the towns contract with the squads, the internal data is in the possession of the squads. So like the towns, you could certainly go to their budgets and pull what are they paying per year. And it's gonna vary a little because there are some where the EMS is still within the fire company. So what that particular breakout is may not be clear because the town would pay a lump sum for both, but how it's divvied up within their own private budget would be a different. So I think we'll need some cooperation on the part of the squads themselves, in which case I would think that we'd probably rely heavily on our EMS coordinators. You know, they meet periodically.
Yeah, we can only get the information they're willing to give us.
Yep.
That being said, which is why I think it's important to bring it to this group and ultimately to the full board, is that those that are responsible for the money being put in their pockets each year do have the ability to ask for that information, and I think that's important. You know, for the folks from Glens Falls, you know, the Glens Falls Fire Department does your EMS right now, but because they're there all the time, they're getting called daily to go outside the city to handle calls in other parts of the county and in Washington County. Why is the Glens Falls ambulance helping out Whitehall? Well, that's a good question. There's 2 less firefighters that you have to put a fire out. Yes, will they get some money for it? Yeah, they'll get some, but they run 2 ambulances. If you put one in Whitehall and one in West Glens Falls, who's covering the town or the city of Glens Falls? And those people are paying quite a bit in taxes for that.
Supervisor
So-
Brock, did you have
I'm sorry,
something?
go ahead.
No.
Well, excuse me, I was gonna say more or less the same thing, or ask the same thing that Matt was saying, 'cause it's hard for us to understand that unless we see who has what and what the numbers are. But the other thing, and Dan could talk more about this than I can, but we went, when I was on the common council, we went from 2 BLS then ALS, and I think our response time is under 3 minutes on average, which is
It is,
then the golden.
and they're making money. The city of Glens Falls Fire Department makes about $200,000 a year just on their EMS, which they can do because they're not paying for the staff. Staff is already there, they're paying for that out of the fire budget. If they were paying for their staff to run those 2 ambulances continuously, they wouldn't have that capability. But
Supervisor
they have an excellent program.
Supervisor Thomas, I think you were next.
Yeah, I have 2 EMTs and, the fire chief.
They double, so we pay them as firefighters, but they have that responsibility.
A lot of times they're dispatched ALS, but when they get to the scene, they're not ALS. So, we have arrangements with, Warrensburg and Luzerne, so half the time, Luzerne's on its way there, but, by the time they get there, the call turns out not to be an ALS call, it's a BLS call, and so they wasted their time running up.
Agreed, and this is an issue, the EMD system, which is standardized across the nation, the dispatcher will go down through and ask very specific questions. And if you answer yes to this question, it takes you over to this column, or no the other way. And unfortunately, a lot of the answers do lead to it being an ALS call, when in reality, the people get there. If the guy says he's having trouble breathing, well, that's an ALS call. It doesn't mean that he's having trouble breathing because he has something stuck in his throat or because it's something else. And those are tough. That's an excellent point, Frank. And right now we haven't come up with a good way around it.
See where it would be difficult, especially when the call phone.
Well, and if you were to talk to the sheriff or the undersheriff, they will tell you right up front, they are not going to accept the liability
Right.
for not sending the right people. Better to send more than less. So that's a tough one, no question, Frank. We do have fire departments in the county are doing well as far as helping out, assisting. I believe all the fire departments do some kind of assist. But it's tough.
I think Supervisor Simpson was next, and then Supervisor Montesi.
Yeah, I just wanted to point out the different geographical differences. Glens Falls, you can have a three-minute response time, and in, North Warren, it might take you 7 minutes just to get to the squad, the volunteers.
You've got areas in North Warren up the other side of, the town of Johnsburg. You're into a 35 or 40 minute ride just to get there. So again, when you're looking at total elapsed time for the call, it's a tough scenario.
So my point is that it, you know, it's important for everybody in the, you know, on the board to realize it may not be as big a problem in Glens Falls in the more populated areas as it is in the rest of the county where it's sparsely populated and it's a severe problem.
And
But,
hence the other side of that problem is the more densely populated urban areas have the number of calls that they can bill for to support it. If you take North Warren and you want them to be there 24/7, yet they only handle 3 calls during that 24-hour period where the city may have handled 25. That's the other part of it, you know. What time of the day don't you want anybody to get hurt?
Supervisor Montesi?
Brian, you know what, after trying to work the 3 squads in Queensbury in some kind of cooperative venture, I mean, we had some success, but as you point out, they're all individuals, but I think that we as a group, if we want to give you some headway and say, put a couple of plans together for us so that we can pitch it to these individual companies, because if they don't buy into it, we're dead in the water anyway.
Exactly, and this is the problem. The last time I brought this forward, the people in the room said there's no problem. Okay.
Hold on, I gotta correct that.
Yes.
People in the room didn't say there was a problem.
Right.
The squad captain said there was a problem.
Yeah.
Nikki guy sat right there and said, you guys are crazy, there is a problem. It wasn't the supervisor, Brian, it was the squad captain.
I was at that meeting and we went right
I'm
around the
Jerry.
room.
Those are the squad captains.
It's definitely a problem for us too, Brian, the small town that we're at. You know, you talk to probably Ray and Linda often enough that you know, and we pay like $80,000 a year to have somebody from E5 who's there 5 days a week sitting in our station. So if we get a call, you know, it's a problem.
Let's
I'd
just,
like to be able to have a couple of plans that we could look at, fuss around with, and then maybe present them.
Your call. I was asked to bring this forward. If the group feels it's an important enough issue that you want to get into it, I'm willing to move forward. The problem is it will take work on those of you that are supervisors or whatever in your towns to help tell your people that they need to start thinking about this. You know, for them, the easy thing is to do is just every year go and increase their budget with the town. And there are some that have taken it to their town to a point where basically they were holding them ransom. And that's a tough scenario. You know, one squad raised their budget in 1 year $110,000. That's not the total, that's the raise. So, as a supervisor, what do? Say no?
Supervisor Gerard?
Just like to get a corral around the comprehensive nature of what you're looking at. You know, from where I come from, Glens Falls, I would say there's no problem because we facilitate it through the fire department. I'm not speaking accurately possibly, but I would say Queensbury, I don't think there's a problem. They have three different squads that contract and have, you know, people. I don't know the situation with Warrensburg, Bolton and Lake George, with the influx of people, etc. But the point being is if those places that are heavily populated or have a tourist accommodation for monthly periods do all right through billings and taking the bulk of the people available that are qualified to do this, then are we technically looking at what I do know? I do know that Stony Creek and Thurman and Hague, you know, those are difficult places that don't have the run volume or the population, and facilitating, you know, this type of venture is a dilemma. So in the discussion, if Glens Falls and Queensbury, my point is, don't want to get involved because they think that they're doing okay, that's the bulk of the population. So where are we at, and what do we really want to accomplish? Do we really want to say that the smaller towns need the help, and we need to work out something in that venture with the ones that don't need the help? How is that possible? Because just sitting here without asking any questions, it sounds like the whole county has a problem. Maybe that's true, I haven't followed it in a while, but if the whole county has a problem, that's magnanimous. But if it's just the smaller towns, I know I've talked to Chief Schrammel, and, he's talked about different ways where towns like Thurman, et cetera, have minimal call volume, et cetera, and how you would handle that to make it worthwhile for everybody. But it's a difficult venture to move forward and to make sure that everybody's happy and likes the quality of service they get. So, I guess my point here is identify where the problems are and then reduce the scope if that could be reduced, and then we could have a better look at it. Right now, it sounds like the whole county has a huge problem. And I would agree with Brian that the city of Glens Falls is right on the precipice of 3 counties, Washington County, Saratoga County, and they do get called for ALS support, et cetera. And they have to get dispatched for intercepts, et cetera, as they come to Glens Falls Hospital. So, I mean, there is some compensation value for that, but I don't know, through the mutual aid system, they knew that that's what they were getting into when they were taking this over. There's also the private ambulance service that still exists for mostly transports from Glens Falls Hospital, other hospitals, et cetera, Empire Ambulance, and, you know, they need to be brought into the equation also as to what their offerings are. I know at one particular time, they were stationing a vehicle up, you know, the Bolton exit 22. I don't know how effective it was, if they lost money, they didn't think it was worthwhile. But there's been some attempts to solve the specific geographic problems. I think we need some more input from where the real problems are.
I would say, Dan, I know I don't know about Lake George that well, but I can tell you from Warrensburg North, we don't we have so many indigent people, Medicaid people. They tell me it costs them $800 to run the ambulance out the door. That's what they told me. And I talked to Gene over in Luzerne, Van Aert Roads, or whatever they're called. They tell them the same thing. It costs them $800 to get the ambulance out of the firehouse or wherever they're housed. So it's a problem in Warrensburg. It's all paid service. There's no local people. Brian talks about the people coming in from down below. I don't think if there's 10 people who live in Warrensburg on the ambulance, that's a lot, because I don't know any of them anymore. And it's a problem. But I would say, I knew Lake George threw a lot of money at this situation, but I would say for Warrensburg, at least Warrensburg, Bolton, I'm not sure about Hague, because I don't know how many calls, but, you know, they do 1,000, 1,200 calls out of my community a year because of the health center and all that. But from Warrensburg North, it is a problem.
Just a great example, way back in the volunteer days, I was always fascinated when a guy comes from Jersey, goes to Gore Mountain, breaks his leg. In Johnsburg, it's all volunteer.
Yeah.
It takes them over 2 hours to get the person down to the hospital and 2 hours to get the rig back in service. And they did that for four of their hours for somebody out of town that is skiing at a state facility.
Right. And
it's handled differently now, and there's charges, et cetera.
I talked to one of the dispatchers the other day, and he was telling us, we were listening, I don't know if it was on Sunday, they were toning out this squad, like Brian said, they went to this squad, they couldn't get this squad, they're going to that squad, and like he says, when that squad finally takes a call, they're down to no ambulance, and they're out of town for an hour and a half, 2 hours. So, it's a real problem. But last time
pyramids, you can take one call that doesn't get answered, and it pyramids to this huge scenario where the dispatchers are paging for 45 minutes and still not getting anybody, and when they do finally get somebody, they don't know where they're going, and, it's a huge issue.
If you could get a consortium, and you could take all those towns and told one person to run it, you would save close to 300,000, 400,000, 500,000 right now. Because unbeknownst to a lot of the people, most of these people who are in charge of these squads are getting anywhere from $55,000 to $100,000. The squad captains are right now, as it sits right now. The people who run these squads are getting $55,000 to $100,000, and then you have an assistant that gets somewhat less than that.
And then you pay somebody else to run it.
And then you pay your billing company like you said, but that's a lot of there's where you eat up a lot of your dollars. The guy who's putting together the schedules, he makes the runs too, you know, in most cases. There's where you're chewing up your dollars.
I think there's also savings. It used to be at Glens Falls Hospital, you could restock your ambulance, and they don't do that anymore, so each squad has to buy their own EpiPens and whatnot. Some squads might need one EpiPen, have to buy 5, and then they expire and you're buying them again. A consortium, I could see at the expense of medical, you know, prescriptions and whatnot, it could certainly save a significant amount of money. I wanna wrap it up because we're getting a little late here, but I'm thinking, what we're hearing basically, Brian, and you can tell me if I'm wrong, is that there's a shortage of ALS staffing throughout the county, and that we may be able to see some financial benefit from a consortium, some form of consortium that would be able to assist the squads. Is that a pretty good synopsis?
Yeah, you know, Dan raises an excellent point, and this is a scenario we've seen before. Okay, so Queensbury and Glens Falls say, well, we don't need the help. Okay, so are you gonna split the taxes? You know, only the towns that are part of the consortium are gonna pay a county tax, or are they gonna do it with their own town dollars? You know, if you live in Glens Falls, you're not gonna wanna pay for an ALS tech, you know, up in North Creek.
Mm-hmm.
So, that's another valid part of the scenario.
Jim?
Yeah, I just wanted to point out that the reason our, response time, it isn't just because of our density.
Right.
It's because we have people on 24/7. We have 2 stations, and it costs us $4.7 million a year to have those, I don't know how many guys we have.
8.
8 that are there, you know, on call for the whole thing. So it's a very expensive thing. It's not just.
No, I agree.
Supervisor Thomas?
I agree with Dan that, you know, if there's another problem in Queensbury and Glens Falls, I don't want those folks to pay for our emergency services. I mean, we're capable of doing this stuff, but we have to join together to do it. You know, if there's no problem in Queensbury and Glens Falls, then that's fine.
Yeah, and there's no reason why I mean, if your town wants your squad to be part of the consortium, then you join the consortium. If not, then don't. There may be a squad right in the middle of all the other stuff that says, no, we got it, we're good. Okay, that's fine.
Supervisor Simpson?
So, and I agree that's what we should look at it. Cause I don't know if it's as big a problem in Glens Falls, but, would that go through your offices, or would that be up to the towns to get together and put out, you know, figure out what we want, and we do something sidestep in the county?
I don't have a problem reaching out and get more details on the consortiums that are out there and how other people are doing this. I haven't gone that route yet, just because of the time factor, and if you're interested in it, I'd be glad to take this project on, but if there's no interest in it, then
I'm interested.
I mean, right now, Essex County they have a horrible problem up there. If you can get an ambulance in an hour, you're doing really well. It's too bad, you know, they're bringing ambulances from Vermont.
Craig?
Share North Warren, emergency squad there. It is a big cost to our town. It is about paid and volunteer, and it's a trend, as Brian had pointed out, that we are face to face with. So we need to look at it, assess what our capacities are right now, and what our demands are and will be, and how best to go about it. Where can it take that shared?
Sure. So,
one thing I would like to see, if you can, forward this on, one of the big issues I see is the training and how hard it is to get it. Right now, if you want to become an ALS tech or a paramedic, which eventually you're going to say you got to be paramedic, the closest place you can go is Albany. And to go down there 3 nights a week, very difficult to do, and that's why people aren't doing it. Because they can take that and spend 1.5 years or 2 years getting their paramedic license, and they come up here and, for what, get paid $15 an hour? They can get that at McDonald's. So, I would like to see our local community college step up and try to help with this. Put on the right training that we need. It may not be a money maker for the college. It may be something that has to be done. That's issues that we've had in the past with them. They like to think that if they put on a program, it's, you know, It's for them to make money, not necessarily provide a service, and I would love to bring that up at the community college meeting, because this is an issue we're having with ACC right now.
I guess the consensus I'm getting from several of the supervisors in the room is there's some interest in the consortium. I think that there are, while not everybody seems to be experiencing an issue at this point, it does seem that there are several issues. Some of them it is a little bit interrelated. Tell me if I'm wrong here, but I think we'd be fairly safe in saying to Brian that we are interested in seeing more information regarding consortiums, staffing, and training, with regard to the EMS issue in the county, and have him report back to us.
I'd much rather do that than say, we're gonna do a county system. As soon as you know,
I don't...
do that, you start another whole scenario with county staff and
Right.
fringe, and, you know, it turns into now you've, doubled the cost of what it is you're doing. If we can do it on a consortium level, or some kind of an organization, where the people are working together, I personally think that's, in the type of county that we have, that's probably a good way to go.
I think that maybe we should start there and have Brian report back to us with some more information. In the future, if it's something we think is moving on, we may have to refer it over to shared services, or it may actually have to come from the squads themselves. I think that's something we need to research a little more as to how joining a consortium would work and those kind of things.
Yeah, I've tried to do that. Unfortunately, the last 3 squad captains meetings have been canceled. So that's 6 months right there.
Yep.
So that's an issue I'm trying to deal with. The same amount of time that it takes to do all this is the same thing for the squad captains.
Mm-hmm.
You know, most of them are pulling shifts or whatever, so we can work on that, no question.
I do feel, Brian, that there's definitely an interest in exploring the consortium concept as well as the training and staffing a little bit further. Mr. Brock?
And ACC, I think we should talk to them again. I mean, they have a nursing program, it wouldn't...
They did briefly have some training course, and it didn't work out quite as planned. Perhaps it's something, I know Brian just indicated he's willing to go back and talk to ACC again, so...
Well, yeah, I mean, the first class that we did there was, we had more attendance than we could handle. And they gained 5 out of the 25 people that took that class at the college, 5 people that had nothing to do with emergency services joined squads. So you sit there and you go, hey, this worked out really well, but there's a problem with the college, so I will discuss that another time.
Okay. So...
Public safety, I mean,
it is
more than just...
It's very important.
...or something.
All right, so Brian, if you would look into that a little bit further for us, I think there's definitely an interest here.
No
And
problem.
Is there anything else that the committee has today? If not, I'd ask for a motion to adjourn. All right, I've got motions everywhere on
No,
that
I
one.
don't
Go
want to.
Supervisor
That
McDonald and
wasn't-
Supervisor Simpson. Thank you so much.